So my name is Gail Picorni. I am the Assistant Program Director for the University of Washington, Alaska Internal Medicine Rural Residency Program. What brought me to Alaska? So I was interviewing for residency at University of Washington and was learning about the WWAMI program. And I heard about this clinical teaching site that was located in Soldotna, which I thought was an island. I'm sure I was told that it was actually on a peninsula, but I heard island. And it just sounded like an incredible place to practice. Like the internists are doing their own procedures and consulting for their family medicine and surgical colleagues, and I thought to myself, that is the type of medicine I want to practice.
I grew up on Whidbey Island in Washington State and was really a Pacific Northwesterner for most of my training. I was actually a categorical track resident. I did a rotation in Soldotna as a third-year resident, and that was a rotation that changed my life. Moved to Soldotna, and the rest is history. I've been here for 4 years.
Really thought I might be here for a couple years and then go back and rejoin academic medicine and kind of rejoin civilization then. As I tell people, civilization just hasn't really called out enough to get me to leave.
When the opportunity presented itself to come here to practice after residency, I jumped. It has fully lived up to my expectations. A rural training program is a blend of urban and rural training with greater than 50% of the training taking place in a rural area. It's a common model in family medicine, but quite novel in internal medicine. Our residents will start, their whole first year will be in Seattle, Washington. That'll be the bulk of the urban time, and they will be fully embedded in the UW's internal medicine primary care track. And they will gain essential inpatient experience, but also have a couple primary care immersion blocks and have a continuity clinic at the VA. And then they will move to Soldotna, Alaska on the Kenai Peninsula for second and third years of training. So those 2 years will be fully in Alaska. While in Soldotna, the residents will have a longitudinal curriculum with multiple rotations, including their continuity clinic, internal medicine and non-internal medicine specialty rotations, inpatient time, ER time, all running concurrently. The residents will also have the opportunity to do elective away rotations, including at tribal health sites throughout the state, so that they can get broad exposure to all the clinical practice opportunities that are available here in Alaska.
The UW residency program prepares residents super well for life after residency. This will prepare people even better for life after residency in Alaska or in any rural community.
Being in the Soldotna clinic really made me reimagine what it could be like to be an internal medicine doctor and a small town doctor. How mentally activated I feel all the time, which is what I wanted. I love problem solving and like intense puzzles. Being the only internal medicine practice on the Kenai Peninsula definitely lends itself to having a unique role in internal medicine that's very different than what it's like to practice in an urban setting. Both being a primary care doctor for the sickest, most complex patients, and then also being a nice resource as a specialist for the broader primary care community. You definitely have opportunities to do things both from a procedural perspective that are different. So doing endoscopy, interpreting echoes, performing stress tests, other procedures that again would be farmed out in another setting.
There's also great medicine practice at the hospital. Sometimes what is on display there is like really high caliber medicine, people thinking, analyzing cases and coming up with solutions that I find pretty impressive.
Practicing at the outer bounds of internal medicine and not in a area of discomfort, but of great joy and interest and curiosity.
Advantages of practicing medicine in a small community has been that as a general internist, I have just a great variety in my practice. There are always new challenges. It does not get boring. There's always something new. And I really feel like I get to practice at the top of my license consistently.
There's a lot that I learned on the fly as I was doing my first year, but really excited to teach residents this rural specific skill set that they're going to need in order to just hit the ground running in whatever position they take going forward. If you're somebody who is leaning towards rural training and interested in having primary care be a part of your future job description, I would strongly encourage you to apply. Rural general internal medicine is a totally different world, and we would really love to introduce you to it.
Really to set the stage for an understanding of what internal medicine, rural primary care can be like, and creating a a curriculum that is exactly what I wish I could have done to do the job that I do, because it's very different than what you get in a traditional academic, urban-based program.
We're looking for applicants who are excited to be part of a novel training experience, kind of willing to embrace those challenges and willing to learn along with us. And I want to say that because of the small complement size for our program, so just 2 per year, we can really tailor the curriculum to our learners' needs and career goals. So if we have folks who want to be exclusively outpatient physicians, we'll be able to get them a really robust primary care toolkit. If we have people who are looking for more of a hybrid job, we'll make sure that they maintain all the inpatient experience that they're going to need for that. So, again, we really will have the agility in the program to meet our learners' needs and goals.
I think it can be really exciting to be part of something new and to be part of building a new program. And so if that's something that you're interested in really developing a center of excellence in something that hasn't been well established and doesn't have really deeply entrenched traditions yet, then I think that's a great opportunity. Being in a small community where there are not lots of other people competing for access to patients and procedures can be a real important source of growth. I think there'll be a lot more ownership of your patients. I think you'll have a lot more autonomy about what you do.
It might not be for everyone, but that kind of like keeping you on your toes and never know what's around the next corner is really exciting.
There is a surprising, I would say, richness to life in Soldotna, even though it's a small town. And I'm even one of those anomalous Alaskan residents who neither fishes nor hunt, but yet I still find that there is a lot to do.
Outside of work is where this place shines. Even though we have long winters, you have to make a point of like getting out regularly. We have sled dogs that has been a great pastime. We're probably on our 6th or 7th generation. I've almost always take the residents out on dog trips, and I've really only injured a few of them. Yeah. So it's really dogs in the winter and gardening in the summer.
So we really enjoy just like family walks and hikes, playground time, beach time, attending community festivals and events, trivia nights, local theater performances, and we've made really wonderful friends since moving to this community.